Today, we're going to teach you how to conduct a proper bag and carry test. Please note, this video is for informational purposes only and that the information presented in this video is not a substitute for medical advice or diagnosis. First, we will define the bag and carry test. The bag and carry test is a functional test designed to integrate endurance, muscle force, and balance capability for everyday tasks. You will need a tape measure and tape, a weight set, a bag used to carry weights, and a stopwatch. Once you have the proper equipment, you will need to set up a course to conduct the test. Here, you will see a virtual tour of the course we have set up. A measured course consisting of 7.5 meters of space and length marked by tape with a 4-step flight of stairs at the end of the 7.5 meters. Before the test, it is a good idea to complete a PAR Q&U questionnaire and it is required that you receive informed consent from the patient. Some contraindications to consider: acute cardiac events, unstable angina, severe aortic stenosis, acute pulmonary embolus or pulmonary infarction, acute systemic infections. And you can also consult the ACSM guidelines for more contraindications to consider. Vital signs must be taken prior to administering the test. This includes heart rate, respiratory rate, and blood pressure. And now you're ready to conduct the test. The individual is instructed to walk the circuit carrying a package weighing 2 pounds, 7.5 meters up and down a 4-step flight of stairs, and back 7.5 meters. On completion of each circuit, 2 pounds of weight is added to the package. The individual continues until he or she is no longer able to complete the circuit carrying the package, recording the heaviest weight the individual carried, or if 10 minutes of time has elapsed. Please keep in mind, this is a near maximal test and may not be appropriate for everyone. Ensure that the patient does not skip steps or utilize the handrails. Once the test is complete, the patient can put the bag down and the weights can be added up. The outcome measure of this test is the heaviest weight carried by the individual. After completing the test, vital signs need to be taken again to compare with baseline measures. Be mindful of any huge discrepancies between post-test and pre-test vital signs. Thank you for viewing our video, and we hope this has been helpful.